Aloha and welcome to the COVID-19 Public Health Action webinar, Challenging Discrimination and Empowering Asian Americans, Native Hawaiians, and Pacific Islanders at the National Level. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator with the Hawaii Public Health Institute. Before we get started, we'd like to go over some Zoom housekeeping. For all questions, please utilize the chat box or question and answers box located at the bottom of your screen. We are not offering continuing education credits for our Public Health Action webinar series. And lastly, all webinars are recorded and will be available on the Hawaii Public Health Training Hui's YouTube channel. Without further ado, it's my honor to introduce you to our guest speakers today. First up, we will have Dr. Amy Agbayani. Amy is a UH Emeritus Assistant Vice Chancellor for Student Diversity. She was born in the Philippines and came to Hawaii as an East-West Center scholar to attend the University of Hawaii Political Science Graduate Program. She was appointed by the governor as the inaugural chair of the Hawaii Civil Rights Commission and is a member of the Patsy T. Mink PAC, the Legal Clinic for Immigrant Justice, Hawaii State Advisory Committee to the U.S. Commission on Civil Rights. Our second speaker today is Dr. Doris Ching, an Emeritus Vice President for Student Affairs of the University of Hawaii System, former Interim Chancellor of the UH West Oahu, and former Associate Dean of Education at UH Manoa. She is currently the Chief Academic Officer of the UH System Academy for Creative Media. She graduated from the from Arizona State University and the University of Hawaii at Manoa. Dr. Ching was the first woman of color and first Asian Pacific Islander to be elected president of the National Association of Student Personnel Administrators. And now, without further ado, I'd like to turn it over to Amy.
Aloha. Thank you very much for the invitation to speak to you today, along with my colleague, Doris Ching. I sometimes introduce her as my friend. I used to introduce her as my friendly boss, but now she's just my bossy friend. And Doris and I collaborate on a number of programs in the last 4 or more decades, but more recently, Doris Ching and I published an article on Asian American Pacific Islanders, and it was published in February, and the impact of the recent issues such as COVID and immigration. And so I'll present first and give some definitions and demographic context, as well as some of the larger themes that we see as challenges facing Asian Americans and Pacific Islanders. And then Doris will provide more details and shares the quotes and results of our survey that we completed last year about the unequal treatment as reported by prominent Asian American Pacific Islanders at national and local levels. So to start, we'll start with definitions. For the past few decades, the term has been that's used as Asian Pacific Americans. And then for the last 2 decades, we've been using the term Asian American and Pacific Islanders. And part of that was the combination of 2 census categories. And the more current term and more inclusive term being used by the White House right now and other government programs is Asian American, Native Hawaiian, and Pacific Islanders. And this is a combination of the US Census category Asian American and the second category, which is called Native Hawaiian and Pacific Islanders. Many of you may be familiar with that, but quite frankly, very few people in Hawaii utilize these terms. Most of us in Hawaii use our own ethnic group, like I'm Filipino, and also, for example, the native Hawaiians have not been that comfortable being incorporated or included in these categories. But at a national level, we use it, and many advocacy groups also use it. This pan-ethnic grouping is useful. Otherwise, the 50 or more ethnic, cultural, country of origin groups would be very, very small at a national level. However, the downside is that the aggregation of these very diverse group really masks a lot of the differences we have in socioeconomic status, history, and experiences. So the upshot summary is that race, ethnicity is a social construct. It's not a biological one, and the definitions changes all the time. For example, I tell people it's not who you are, it's when you are, and also sometimes it's not who you think you are, but who other people define you as. So the demographics, Asian American, Native Hawaiian, and Pacific Islanders as a category are the fastest growing racial ethnic group in the nation, and actually have been for the last 2 decades, and most people don't know that. Right now, there are over 20, it's close to 23 million in the United States are Asian American, AANHPI. And this huge category is 6%, but in the nation, 60% are white, followed by Hispanics, 18%, Black Americans, 12%, Native Americans, 1%, Native Hawaiians and Pacific Islanders together, 1%. And so it is a very diverse group, but the largest group, over 85% of this big category, are Chinese, 23%, Filipino, 19%, Indian, 19%, Vietnamese, 9%, Korean, 9%, and Japanese, 7%. That is nationally. But it's also very different in Hawaii, as many of you know. While we're 6% nationally, AAPI, NHPI, Hawaii is actually 2/3 AANHPI. So that is a different percentage, and your experience as a Pacific Islander, for example, would be very different here than it would be in the mainland. And just one more piece of information is that more than 25% of the state of Hawaii, and I think it's an undercount, say that they are more than one race. Yet nationally, it's just 3%. So again, it's a very different experience of being an Asian American or a Filipino here for me, or when I am in the mainland. And another point I wanted to say is that there's such a wide range of experiences and socioeconomic status of these groups, and yet we are considered one group. For example, the Indians, Chinese, Japanese, and Filipinos on the mainland have a higher socioeconomic and educational status in the entire US population. But some of the smaller groups are significantly worse off than the US median. For example, just in one statistic on graduate professional degrees, 10% in the nation have a graduate degree. 20% of the AAPI have a graduate degree, but 40% of the Asian Indians have a graduate degree, and only 3% of the Laotians have a graduate degree. So we're really quite varied. Doris and I have done a number of studies over the last 30 years, and unfortunately, the issues remain the same. Although the most recent, our current situation and anti-hate sentiments have been amplified enormously because of COVID. But the issues that we identified many years ago continue: discrimination, lack of representation, being a perpetual foreigner, not being American, and being a model minority, which is both a plus and a real disservice to certain groups. So the issues remain the same, but have been amplified. For our study, we identified 5 things that are of interest that are barriers and challenges that we have to deal with right now. And they're interconnected and in a sense, not only interconnected, but are becoming our national and local issues. For many years, Asian Americans and Pacific Islanders and Native Hawaiians have been invisible or erased in many of our histories. So last year, the big thing was actually the US Census. There's a big push to make sure that undercounted or minority groups were counted. And there was a lot of effort even locally for Native Hawaiians and Pacific Islanders and Filipinos to have special outreach efforts so that they would be counted. And the reason it's important to count everyone is that a lot of resources are determined by the census count, as well as political representation at the national level. And so a lot of advocacy groups were very pleased that the US Supreme Court determined that the citizenship question that the Trump administration wanted to include was excluded. And the reason was that a lot of the particularly Asian American as well as Hispanic community would be frightened to answer these questions on citizenship. So it has actually increased. We believe that with the Supreme Court saying that citizenship was not to be asked in the census, we think that it'll be a more accurate count, and hopefully the information that we get from it can also help get better policies and better services. The second area, as you all know, is COVID. It's undeniable that it dominated nearly every aspect of life in Hawaii, globally, and other US states. As you all know, the US led worldwide on COVID-19 deaths and infections for a certain period of time, and that it impacted US ethnic groups disproportionately among communities of color. And on the mainland, in the continent, for example, there was over a 5-year average, the death average showed 9% increase for whites, but for Asian Americans, it was 35%, and for Hispanics, it was 44%. So a lot of this impacted the Asian American, Native Hawaiian, and Pacific Islander communities severely. And I won't go into the economic impact, but again, the economic impact was disproportionate to the communities of colors. Then the third area that really impacts our national policies and how we treat each other in race relations is immigration. So attacks against and support for immigrants affect the Asian American Pacific Island communities directly, as 2/3 are foreign born. And as I mentioned, President Trump's harsh and cruel policies was really an attack on immigrants and essential workers. For example, in the health field, Asian American Pacific Islanders account for 1 in 5 physicians and 1 in 11 nurses. And the immigrant share of the healthcare workforce nationally is double the workforce. The workforce in New York, California, and New Jersey and other states had more than double the number of healthcare workers. So immigrants and Asian American Pacific Islanders are real important healthcare providers and policymakers. Then the fourth item that I wanted to touch on was the 2020 elections. I keep on saying everything is political except for politics, which is personal, but the elections do matter. Voting does matter. And the largest minority group in the nation is Hispanic, 13% or nearly 30 million. And a close second is African American, about the same percentages. And the third group is Asian American, Native Hawaiian and Pacific Islanders, or 4.5% of the voters, or over 10 million voters are AAPI. And in the last 2 decades, the Asian American electorate grew by 140%. And this is in contrast to some places where the white electorate grew by 7%. So the impact of Asian American, Pacific, Native Hawaiian, and Pacific Islanders as a group is very critical in some competitive states, such as Arizona, North Carolina, and in Georgia. It was quite clear that the Asian American Pacific Islander group voted with the Democratic candidates in great numbers. And so a lot of people see the Asian American and Pacific Island group as an immigrant community, and 2/3 of them are, but the majority are naturalized citizens and they can vote. So I think people are taking notice, but still Asian Americans and Pacific Islanders and Native Hawaiians are usually invisible at the political area. And then the final point, which I think is very important, is racism and harassment. The increase was just enormous in the last year of anti-Asian as well as anti-Black and other people of color's situation. And of course, it didn't help that President Biden and other officials referred to COVID-19 as the Chinese virus. And Asian Americans were on the mainland reported being subjected to slurs and jokes more so than the other ethnic groups in the state. And more recently, one report showed that there was 165% increase in anti-Asian hate crime reports to police in 16 major cities. So oftentimes Asian Americans and Pacific Islanders and Native Hawaiians are pitted against or not seen as supporting other ethnic racial groups. But I believe that that there was some understanding, a better understanding about after George Floyd and Breonna Taylor killings, that racism is a real problem, that Asian Americans particularly have benefited from a lot of civil rights legislation and advocacy that other groups such as the Black have led, and that many Asian Americans systematically and made every effort to join the multicultural problem and of racism and during the George Floyd and Breonna Taylor demonstrations. So at the local level, what can we do, and what is government doing to deal with racism as it relates to Asian American, Native Hawaiian, and Pacific Islanders? And President Biden actually had on his first day of office created a whole list of issues and as to actions that he could take to improve the situation for Asian Americans. And with a lot of pressure, we now have two major leaders for at the federal level. After Senator Hirono and Senator Tammy Duckworth complained, we have now President Biden announced the appointment of an Asian American Japanese woman to be the liaison for him in the White House on these issues. She happens to be from Hawaii. And just last week, President Biden appointed the White House director for AANHPI initiative, which is a very major expanded group to look at all the government policies and programs. And that happens to be a native Hawaiian from Hawaii. So at the national level, I think, there's a lot of more work to be done. But I was also pleased to say at the local level, at the state legislature, there were two resolutions, one talking about condemning all forms of anti-Asian sentiment related to COVID-19, urging greater investment in federal, state, and local resources. And then this other concurrent resolution was on declaring racism as a public health crisis. And the statements were quite strong, and they talk about systemic racism. And so in a way, we would never have gotten these resolutions passed if it weren't for the horrible experience of the pandemic and the horrible experiences of individuals on the mainland. At this time, I'd like to turn it over to Doris and ask her to share some of the information and the results of our survey.
Thank you, Amy, and thank you for that very comprehensive background and introduction. And thank you, all participants, for all you do to keep, on a daily basis, to keep our community healthy and safe. As Amy mentioned, we had done a survey, and a year ago in May 2020, in preparation for this article that we were asked to write by the National Online Journal of College and Character, we sent a survey to 26 nationally prominent AANHPIs from Hawaii and other states to get a realistic view of the state of these groups across the country. 17 who responded to the survey included Asian Indians, East Asians, Filipinos, Native Hawaiians, Pacific Islanders, and Southeast Asians. They included 4 congressional delegates, 5 university presidents and vice president, 5 faculty, a judge, a retired U.S. Army Major General, a nationally known journalist, president of a major national Asian American association, and other prominent community members. We asked the survey participants to share personal experiences or observations of unequal treatment and discrimination they experienced because they were AANHPIs. All of them lived most of or all of their lives in the US, and all of them obviously are highly prominent and respected nationwide. Still, every respondent had encountered discrimination throughout their lives. It was also evident that the pain of being reminded or reminding themselves of the discrimination they endured was still like fresh wounds in the minds of several respondents. Racist attacks do impact physical, emotional, and mental well-being. So racism is indeed a public health issue. Our own Hawaii senator commented in her response that even before May 2020, violence and anti-Asian sentiment had tripled with NHPIs reported being spit on, punched, stabbed. And in professional settings, the respondents to our survey reported being called derogatory names, questioned about their US citizenship, asked where they learned to speak English, and not taken seriously as leaders simply because they were Asian Americans, Native Hawaiians, and Pacific Islanders. One respondent felt denied scholarships and unfairly unvalued in the workplace because of the model minority myth that AA and HPIs were higher achieving and more academically and economically advantaged than other minority groups. One Indigenous scholar respondent postponed a tenure and promotion application for a whole year after the department chair called their research on indigeneity as irrelevant and minimized their publications. One senior woman administrator wrote, "My supervisor was verbally and abusive and constantly accused me of being too passive and quiet. Yet every time I tried to speak, he would raise his voice and pepper me with an unending number of new questions." I'm sorry, I have competition here with the birds outside. "He constantly belittled me and told me that I was an ineffective administrator and began a concerted effort to fire me." We note that this particular administrator is now a highly respected university president in a large state. We noted a contrast in responses and an unevenness of attacks on Asians reported by those who lived in regions of substantial numbers of AAPIs from regions where AAPIs were sparse. Those who lived in sparsely AAPI populated areas expressed fear of racist attacks and their safety, while fears were not mentioned in responses of those who lived amidst larger AAPI populations. Nonetheless, AAPIs in all regions believe that systemic racism needs to be addressed in solidarity with other racial and ethnic groups, including African Americans and Latinos. And we know from our experience the power of strength in unity and numbers. I add here that Amy and I have been inspired in our social justice research and endeavors by our interactions with the late Congresswoman Patsy Takemoto Mink, the first woman of color elected to Congress, a visionary and trailblazer in partnering with multiracial groups as she fought for equity for all persons of color and censured white supremacy and segregation more than a half century ago, more than 50 years ago. She was the only Asian American member of the NAACP, and that we know as the National Association for the Advancement of Colored People. We can all emulate Patsy Mink's courage. We urge AA and HPIs to protest racism in solidarity with other racial groups. We encourage AA and HPIs to join forces in unity to support and empower our counterparts across all regions of the nation and create a powerful force for equity and justice for all racial groups rather than standing alone. This means sharing our rich resources of a region with another region where resources are very limited and indeed even non-existent. We can encourage ourselves, our colleagues, our students even, to be allies for eliminating hate and racism. We can report incidents of racism to persons of authority who can take action. We don't have to take the action ourselves. We can discuss racism in a respectful and reasoned manner. We can learn to use our voices and be heard. And voices need not be loud or rude in order to be heard. Voices can even be in writing. We can document incidents, for example. Of course, we can all get civically engaged and again, this would be within our own comfort level. We can become familiar with the issues of hate and racism as we respect all cultures. We can support anti-hate organizations and activities by standing up for others and by supporting victims of anti-hate attacks, again, in a safe manner. And we can model certainly healthy responses of courage and unity against hate and racism. And perhaps, Amy, you may want to add something about impacting public policy to eliminate anti-hate racial incidents, including the resolutions and other actions taken by our state legislature. Amy?
Thank you. I just wanted to add that Senator Mazie Hirono and Congresswoman Grace Ming, both of them, by the way, replied to our questionnaire, introduced and got passed anti-Asian hate COVID bill. And it was bipartisan and was signed by the president. And so what it does is it makes reporting these hate crimes more easily, and it also provides a little more resources and policy and attention to Asian American hate crimes. And so I think for so many times, Asian Americans and Native Hawaiians and Pacific Islanders at the national level have been invisible. And many of the incidents, for example, there was a recent popular survey of people. They were asked to please name one Asian American prominent leader in the nation. 42% could not name one. And the ones that they did name was Bruce Lee, who I think had died 50 years earlier, and Jackie Chan, who happens to be from Hong Kong and lives in Hong Kong. So none of them even recognize Vice President Kamala Harris, who is the daughter of an Asian Indian immigrant mother, and her father is also African American person. So we're invisible at the national level, but and then locally we have a number of daily strange, ridiculous comments and issues that we have to call on. For example, just last week, the mayor nominated an individual to the police commission, and it so happened that he is a white man and a business leader and has lived in Hawaii for 30 years. And Councilwoman Esther Kia'aina, who happens to be Native Hawaiian, asked him what he thought about racism in Hawaii, and he had never seen any racism in Hawaii. He doesn't know anything about Hawaiian history. He seems to be tone deaf to looking at the data on poor outcomes, overrepresentation in the police, in the prisons of certain groups like Native Hawaiians and African Americans in Hawaii and Pacific Islanders. And also he doesn't understand, and many people don't understand, that racism and white privilege is part of our history, and we have to really take more intentional efforts to check ourselves on our own racism and look and also call it and support those who are trying to address it. And so we would actually welcome your questions, and also for the COVID response. And as we pointed out, there is two resolutions calling racism is a public health crisis, and that is our own state legislators are saying that. And so the work that public health educators work in deal with issues of inequality, and that efforts have to be improved to make sure that no group is left behind. And the COVID situation amplified the fact that no group, if you do leave certain groups behind, it will be negative for everyone. So it is really to the self-interest of the community to provide appropriate services and equal access to every member of our community. So we welcome questions from the group.
Thank you, Amy, and thank you, Doris. That was a wonderful presentation. And I just wanted to clarify, Amy, are you asking for the attendees to provide any examples of racism that or discrimination that they've experienced in the work that they do in the communities?
Yes, and our experiences here in Hawaii,
Yes.
some different from their experiences on the mainland, but it would be interesting to hear any experiences they had.
Absolutely.
Workers.
Yeah, so if the
Yes.
attendees feel comfortable, please feel free to share any sort of experiences that you've had either personally or professionally. You can drop that into the chat. Also, if you are comfortable, make sure that you are sharing with both panelists and attendees so other attendees can also see your comments. But we'll take some questions and then maybe I can go back to the chat once people have started filling that in and I can read some of those comments off. So the first kind of question that we have is, how can we, you've mentioned in the presentation that racism is a public health issue. So how can we help people understand that racism is a public health issue?
One of the ways to do it is to just look at the data, the evidence. I don't think God gave us certain groups more marbles than other groups, and that how do you explain the poor health outcomes of certain groups, if not that there is systemic problems? How do you explain that the educational status of certain groups is so bad? So, and also that your zip code is going to predict whether or not you're going to do well or have a problem with the police. So I think some of these resolutions in the legislatures was really good because they ask for example, look at racial disparities in the criminal justice system, try and prioritize racial equity in decision-making, acknowledge communities of color have borne the greatest burden of inequitable social, environmental, and economic. So I think just looking at the data, but lots of people, and some doesn't seem like racism. For example, we have a young friend, she's a sophomore in high school, and she supposed to take an Asian studies class as a requirement. She looked at it and she said, this sounds good. It's about Japan and China, but how about the Philippines? There's nothing here about the Philippines. And then the teacher, which is pretty good, said, let's do something about it. You do something about it. And she has. She and her and colleagues in public and private school, I said, we should know a little bit more about our own history and our own culture, as well as the history and culture of Filipinos here in Hawaii, and it goes on and on. And a lot of people, by the way, don't see it as racism when they look at the statistics of higher education, even here in Hawaii. For decades, I keep telling everyone I could fit all the Filipino faculty in my Honda, yet we represent 23% of the public schools, but we're not represented among the graduate students and in leadership positions. Some people do not see this as racism. They say, duh, so what? Get on it's your fault. You didn't get the degrees and you don't know how to network. But so if you look at disparities, I think that's where it's easy to say that there is something systemic and wrong, and that can be changed.
If I may add, thank you, Amy. And if I may add, I think more panels like this and more information out to the public about how people are feeling and about their experiences. For example, in our survey, again, there was one, well, first of all, many of the respondents really were hesitant to reply to our survey because they were afraid to be identified or that their institution would be identified. We had to reassure them that we would keep this all confidential. Someone on the East Coast, a Southeast Asian woman, said she lives in daily fear that every time she goes to the grocery store or any place in the public, that there will be some kind of altercation. She's just ready. She just braces herself. She also is so fearful for her partner, who happens to be Chinese American, that he will come home safely every day. I mean, these are just another example is a university president of a very prestigious university in a very a safe neighborhood, actually, was also hesitant to respond because he said he was admonished by his relatives who live there that every time he goes out on a driving his car, that he may be stopped by a police officer. And should that happen, he must keep his eyes straight ahead. He must keep his hands on the wheel and answer the questions directly. I mean, these are people who live in fear, and their experiences should be shared with the rest of the public to show that this is not a healthy situation for anyone in terms of emotional and mental well-being. I can go on and give you many other examples, but that will just give you a flavor of the kind of anguish and fear and anxiety that professional people, successful professional people are facing each day. Can you imagine those who are not as prominent and highly respected? Their fears, I'm sure, are even more pronounced and really need to be addressed.
Thank you. So I do want to come back to your comment, Doris, about the police in our next question. But before we move on to that, Amy, can you actually share the resolution numbers so folks could look them up?
Yes, they're very good. House Concurrent Resolution 154, it deals with anti-Asian hate. SCR 66 also deals with anti-Asian hate. And HCR 112 and SCR 140 deal with declaring racism as a public health crisis. And the text of the resolutions are really, really good. I wish I had written them.
Thank you. Okay, so the question, going back to you mentioning that fear of going out for a drive and possibly being pulled over by police. So
yes,
the question is, with a growing distrust of police groups, are there other alternatives to police that can handle unlawful racist acts?
Well, first of all, the police are responsible. That is them. That's the primary institution we have. So we have to reform the police, make changes in the police, and it also comes from top down. For example, the new police chief has to understand not only he has to understand the ethnic relations in Hawaii, and also, even though that individual may not be personally racist, there are so many policies and procedures in place that have to be changed. And some of the advocates on the mainland, for example, have looked at policing changes. For example, don't go and pursue a hot chase by car. Just wait and figure it out a little later. Where are they? Or don't, but really implicit bias is very hard to stop, and it's there and it's real. And so, the two incidents, the killing of a Black man in Nuuanu and the killing of a Pacific Islander youth who was with a group, I think they were pursuing and stealing something or other. You gotta ask, why are there the numbers there? I mean, and I think that's why these resolutions talking about the economic structure, the educational barriers, the language barriers, and all of these kinds of things relate to racism. And so it is, some people think that Hawaii racism is mild and different and gentle, but it still has many of the same results. Of course, I cannot, my dissertation, by the way, was on Black student protest movements of the South. So I've always been interested in the Black civil rights movement. And so their experience about driving while Black is well documented. But even here in Hawaii, for example, and I'm at the university, I retired from the university, they didn't see it as racism or stupid, but they don't support programs like ethnic studies, or even public health, or the translation center. But I lobbied with a group, for example, the African American faculty position was vacant and they were not going to fill it. And I said, duh, you cannot have an ethnic studies program if you don't have someone who knows about Black experience in Hawaii, as well as the civil rights movement in the United States. And also, it's a little hypocritical not to do this when we're all saying, let's have the Obama library or something or other. And so that person didn't see that as weird. So the next day, we asked our legislators that this was not right. And so we actually now have, they did change their mind and the budget was improved. But even last year, when they were doing budget cuts, guess which programs they want to cut? These programs on ethnic studies and understanding our history and culture and inequality and prejudice. That's part of Hawaii's history. And those are sometimes the programs that don't get supported. And some people don't see that as racist, and they probably are okay with not calling it racist. But I would say that it's unequal treatment and unfair.
And indeed, educational institutions like higher education, but also K-12 education groups, organizations, and actually even business and other professional groups can take this kind of issue up. It does not have to be just a police force and policing, because the racial profiling is everywhere and it's really all of our responsibilities. So organizations like individuals can use their voices to help the whole community address this situation. In the examples I gave you, in the example of the university president driving his car, he was not African American, and we associate this reaction from the police to mostly African Americans. They see that every day, but even this particular Asian American NHPI person has experienced that more than once. So it's the organization does not have to be just the police force. It's everywhere in the community, in the public and private sector, from my point of view.
And sticking with that, do you have any recommendations or can you recommend any racial equity resources that exist in our state?
Um, well, first of all, the Hawaii Civil Rights Commission is the state agency empowered to enforce the civil rights cases in Hawaii. And so I think individuals who do have a complaint should actually talk to whoever their supervisor is, if it's an employment issue, and actually make complaints to the Hawaii Civil Rights Commission, or there are federal offices related to that also. I think many of the ethnic groups in Hawaii have wonderful community organizations, and that it would be nice to support them and to actually participate in other ethnic cultural celebrations that we have in this multi-ethnic community. So I think if people just would learn a little more about one's own ethnic culture, and also participate in other ethnic cultures. So there are a number of community organizations, and for me, I look at the university and the Department of Education as institutions that can do better and have a great responsibility to address issues of racism and equality. Just one example, you don't have to be Filipino to just help Filipinos, or you don't have to be Black just to help Blacks. Every ethnic group can address the issue. One good example is, I like him very much. He happens to be shorter than me. The new superintendent of education, Keith Hayashi, principal of Waipahu High School, has done tremendous work over the years. For example, we had he has the highest number of low-income kids going into college for dual credits. Waipahu is 68% Filipino and 15% Pacific Islander. They got 10 of this year's national presidential merit nominees. And when I worked with Principal Hayashi with a GIRAP grant, our federal monies paid for the Ilocano faculty member and the Samoan faculty member, so that it was included in the curriculum. But when the funding was going to be running out, the principal funded them with state funds. That was not any pressure from us. He understood that, these children in his school will really benefit from understanding their own history and each other. And so he supported that. So I think, I don't think we have to have an entire curriculum or resources on anti-racism, but we have to actually look at every decision we make and to say, is this fair? Who is the victim here, and who has to make the most changes in their actions? And so I think each one of the members of the audience in their workspace makes those kinds of assessments as to how to make a decision that is not racist.
I think in Hawaii, certainly we have been, I guess you could use the word sheltered from these kinds of racial attacks many times. But that doesn't mean that it doesn't exist with us or that we haven't experienced it. And many times we experience it when we leave Hawaii for school and other things. And while we may not have experienced it in our lifetimes in Hawaii, or they have not been as harsh as some other attacks in other states, our sons and daughters and our other relatives and people we know do live elsewhere where they have these kinds of experiences. In another presentation that we made recently, one of the participants commented that when she went to school in Wisconsin, the professor looked at her and said, where did you learn English? In a very, very harsh way. And she didn't know he was talking to her because she was from Oregon. And she said, I was born in Oregon and I came here to Wisconsin to go to school. And we have that kind of experience. And we have many, many, in some ways they're called microaggressions, but microaggressions are also hurtful and they do impact us in unhealthy ways. My own sons and daughter-in-law also had experiences where they went to school, both undergraduate and graduate school in other states, but they never mentioned it to me because they handled it in their own ways until I asked them, and I got barraged with the kinds of experiences that they had experienced, but not discussed with us. So open discussion, I think, is healthy and is important and is necessary if we are going to address these very unhealthy situations.
Thank you. So we have about 4 minutes left. So I'm just going to read off a couple of the comments that attendees put into the chat box. So first comment is, being a mixed girl, my mom is Hawaiian Chinese, my dad is white and Native American Indian. On the mainland, riding a bus, they would make me sit in the front and my mom and older brother sit in the back. Even in the public restrooms, I couldn't go with my mom. This is when they were living in the South. Another comment is, unfortunately, you do not hear much about the racism that is currently occurring or happened in the past in Hawaii. The little I've heard has been from PBS or NPR. Mainstream media or education does not cover it, which is so not okay. So thank you for the attendees making those comments. Doris, did you want to add something?
I just want to say that hearing about that situation on the bus is so hurtful to me. And I'm so sorry that happened to this person. These are the kinds of things that we simply must address.
Mm-hmm. So in about 1 minute, if you wanted to leave anything with the attendees, if you have any last minute comments, please feel free to do so.
This is Amy. I do think that your profession, which is public health, has got, at least officially, has gotten it. The policy statements of many of you, and actually you did testify for these resolutions. Your organization did, and my organization did. So I think we got it officially, and at a philosophical level, you know, and I think the next level is to really call on department agencies, for example, like Department of Health. We continue to attack them on not providing enough support for the Office of Language Access for, you know, again, that is not seen as racism, but it is not providing access, equal access. So I think my final point is that we are all essential workers. Everyone here is, and we belong, and that there are great possibilities to improve the situation because these are our neighbors and our bosses and our teachers and our politicians. So I think for every act we can be intentional about being fair and trying to empathize as to how that situation would affect you.
And I just want to add that I thank you very, very much for your interest and your participation today, and for staying with us, even though, as Amy said, we have a boring talk without any video or visuals or other videos. But thank you so much. I hope that we can meet you personally sometime.
Yes, it was extremely captivating. I think this is a very hot topic, and we've been very interested in providing a webinar on this topic. So a really big mahalo to both of you, Amy and Doris, for being our presenters today. And yes, I do hope that we can have more of these discussions in person one day. Another mahalo to everybody on Zoom. Mahalo to the HIPHI staff behind the scenes. Please save the date of July 7th for our next public health action webinar. We will be sharing the details with you as soon as we have them available. For now, be safe, be well, and we hope to see you on a future webinar. Aloha.
Aloha.